Mrs. G was 84 years old and had played an important part in her granddaughter's life. Her granddaughter told us more about her. Her words are spoken by an actor.
My grandmother was a very happy and jovial lady. She enjoyed watching sport, Formula One, tennis, athletics and especially football. She always liked speaking to people and would start a conversation with anyone she came into contact with. She had a good sense of humour and was always laughing and smiling. Before her accident, which left her in hospital, she was very mobile and went out to the local shops and into the town centre to do her weekly shopping. She enjoyed spending time with her family. She was always a huge part of my life, living next door to me while I was growing up, and she then moved in with me when I was 16.
Mrs. G fractured her hip in a fall and had to have an operation. She was discharged to a nursing home and given a prescription which included diclofenac, a non-steroidal anti-inflammatory drug. Following receipt of the hospital's discharge summary, Mrs. G's local GP practice added the medications to her list of repeat medications. And for the next 11 months, the practice continuously prescribed diclofenac to her without review. Crucially, she was not co-prescribed a proton pump inhibitor to prevent the build-up of gastric acid, which can lead to duodenal ulcers. Towards the end of the year, Mrs. G went to live with her granddaughter, who quickly noticed that her grandmother was having difficulty with eating and that her health was deteriorating. Things came to a head on Christmas Day.
My grandmother was violently sick and as white as a ghost. She could not move and she was in pain.
Mrs. G was taken to hospital and underwent emergency surgery for a perforated duodenal ulcer. Sadly, she died 2 months later from septicemia, acute renal failure, and urinary tract infection. Mrs. G's granddaughter, who had also recently lost her mother, was immensely saddened by her grandmother's death. Realizing that she had been taking diclofenac for many months, she complained to the practice about what had happened. They investigated her complaint and accepted that they had not checked and reviewed Mrs. G's medication. As a result, the practice changed their prescribing procedures and now check for other patients taking non-steroidal anti-inflammatory drugs without a proton pump inhibitor. However, the practice's response did not answer Mrs. G's granddaughter's questions about why things had gone wrong.
At the end of the surgery's reply to my complaint, it mentioned I could complain to the Ombudsman. I approached the Ombudsman as I wanted answers. I felt that I was being fobbed off by the surgery and made to feel like I was making a fuss out of nothing and reading something into nothing. I was 22 when I complained and made to feel that due to my age I was not being taken seriously, no matter what questions I asked. No matter what the result, whether it was in my favour or not, I wanted and needed answers to the questions that I had. I also hoped that the investigation would be thorough and actually encourage the surgery to make changes, which would in turn have a positive impact on the lives of other patients and families. I wanted the Ombudsman to ensure that the treatment my grandmother received would never, ever happen again to any other vulnerable and dependent elderly person.
The Ombudsman took up the complaint and found that the initial cause of the problem was that it was administrative staff at the practice who had added diclofenac to Mrs. G's list of repeat medications. But the major cause was the practice's failure to follow their protocols or the professional standards relating to prescribing and reviewing medication. No doctor reviewed Mrs. G's prescription or considered co-prescribing her a proton pump inhibitor. All of this put Mrs. G at increased risk of developing a duodenal ulcer, which is in fact what happened. As a result of the Ombudsman's recommendations, the practice apologized to Mrs. G's granddaughter. The Ombudsman's report was also discussed at a significant events meeting, which was attended by all the practice's doctors, nurses, and administrative staff.
I hope that people will seek comfort from my grandmother's story. It doesn't matter how old or young they are, sometimes questions need answering fully. They have the right to ask those questions and to get a sufficient answer. All patients deserve to be treated in a fair and consistent manner, and all procedures should be followed and not overlooked, no matter how small or silly they may seem. My grandmother was a very important and influential lady, and by telling her story I hope that others that are in the same situation are able to realise that there is an organisation the Health Service Ombudsman, which can help them.